Let's begin this video discussion with this beautiful ad that caught the imagination of the country, and see this particular clinical case that actually have resulted due to the condition that is mentioned out here, where said Jadeja was practicing hook shot when a bouncer from Stark slipped in between the helmet guard and resulted this injury. What about the condition is right? So you can understand the ball is striking almost the ear. So what can happen in this particular case? So what you are seeing out here is a heart-shaped pupil. You see, it's a heart-shaped pupil, and this is condition is known as traumatic iridodialysis. This is traumatic iridodialysis. Traumatic iridodialysis. So initial symptom will be visual blurring and pain. Iridodialysis. Here you can easily understand this is a blunt trauma that have resulted this, but penetrating trauma can also result in this. So here due to penetrating trauma only is the word. It is not a correct option. It can result due to both blunt and penetrating trauma. So what actually happens in this condition? There is a traumatic separation between the iris root and the ciliary body, and there can also be resultant hyphema out here. There can be hyphema out here, collection of blood, depending upon the level of the injury, and here it can lead to increase in intraocular pressure, so that can lead to glaucoma. So option C is correct, option B is correct, and it also can trigger inflammation, so that can result iritis too. So this option is also correct, but we understand there is increased IOP, and first thing we will do to give topical anti-glaucoma drugs. Topical anti-glaucoma drug like acetazolamide. If it can control, then it's fine. If it cannot control, then we have to go for surgery like filtration surgery, and that comprises both trabeculectomy and anti-metaboloid therapy. So option E, you only opt for filtration surgery when the topical anti-glaucoma drug cannot control it, not in all the cases. Now what other thing can happen out here? There will be increase in intraocular pressure, and there would be dislocation of lens can happen. So there will be anterior dislocation of lens, and also in the chronic phase it can lead to visual field loss and optic disc cupping. So this particular surgery, trabeculectomy and antimetabolic therapy, together known as a filtration surgery, which is going to be done when it is not controlled by the topical anti-glaucoma drugs. Hope you like this particular presentation. you like the video hopefully, and you understand this is a important, also short note topic, but it is very important PG entrance question, image based question, and also it is AIMS new pattern and PGI pattern question. So hope you like this particular presentation and enjoy the season and last few days, and remember the 15th is the known as slab day. So you have to understand, so you have to be very cautious for coming to 3 days, because 15th is also known as slab day. Thank you.